Hello guys, welcome to my YouTube channel. My name is Kanika Arora and you're watching my channel The Medical World. Today our topic is about the patient positioning. In this topic, I will tell you the guidelines of the patient positioning, how you have to do and what are the goals of it, why we do it. So let's start the topic. First of all, we will know about what is the patient positioning. So here's the definition of patient positioning. Patient positioning involves properly maintaining a patient's neutral body alignment by preventing hyperextension and extreme lateral rotation to prevent complications of immobility and injury. Positioning patients is an essential aspect of the nursing practice and a responsibility of the registered nurse. So, patient positioning is very important because it can arise many of the problems if the patient positioning is not done. And remember that a patient positioning, repositioning should be done every 2 to 3 hours in order to prevent the complication of the pressure ulcers, which is very common in the patients. Next one is about the unnecessary exposure. Whenever you are doing in the surgery or doing the specimen collection or doing any treatment, positioning should be done in a very comfortable way so that it can maintain the patient's dignity. That means the patient should not feel any type of discomfort or it should not be there that the patient is exposed unnecessarily. So patients dignity and respect should be there when you are positioning a patient. And in most of the hospital settings, positioning patients provide the airway management as well as the ventilation to maintain the body alignment, and it also provides the psychotic safety. So these are the benefits of the patient positioning, as it provides the airway management because it allows the area of the body for the air clearance as well as the ventilation so that complication can not occur. Topic is the goals of patient positioning. Our first goal is to provide the patient comfort and safety. That means patient repositioning is very important as it is important for patient's comfort. For example, a patient keeps on lying on the bed in the same position for 24 hours. The the prominent part will get some pain and it will just disable the comfort of the patient. That is why the patient positioning is done. And second one is to maintain the patient dignity and privacy. When you are doing the patient positioning, it is very important to just involve that area which is to be used. That is, don't involve or don't expose the unnecessary part that is not used for the patient positioning, as well as patient maintain the patient dignity. That is, first ask for the permission that we are going to do this, we are going to position the patient. Ask them first if they give you permission, if they have the reinsurance, then you have to do the patient positioning. Third one is allow the maximum visibility and access so that it is done, it is changed time to time so that the patient can have access to different things. Next, we are going to discuss about the guidelines for the patient positioning. So, I will explain step by step what we have to do first and then second. So, the first guideline is to explain the position. Provide the explanation to the client on why his or her position is being changed and how has to be done. I explain you first, you have to maintain the patient's dignity, ask for permission that we are going to change their position and why we are doing that. Refer the patient will give you more likely to maintain a new position so that you can do your work comfortably. And the second one is encourage patient to assist as much as possible because some clients are heavy weighted and some are thin. So if they know that you are going to change their position, it will help you to perform the better things. So here it is written, determine if the client can fully or partially assist. Clients that can assist will save the strain on the nurse. Yes, because it is totally body work, it is totally the body mechanics. The nurse will save the strain. It will be a form of exercise, increase independence and a self-esteem for the client. The third thing is get acquainted help. When planning to move or repositioning the client, ask help from other caregivers. Positioning may not be the one person task. Whenever you're doing the patient positioning, sometimes you can't do it alone because the client can be heavyweight or underweight. It is very difficult for one person to do so, as it can crack someone's bone or it can hit someone on the floor. So never try this, always seek for help. The fourth one is use mechanical aids, bed boards, slide boards, pillow, patient lifts and slings can facilitate the changing position. These are the mechanical aids which are called the slide boards, pillows, patient mechanical legs, patient lift, you can also see, and slings, which will help in change the position. So you can see this in the hospitals when you will have the placements, or you can see in your nursing books or the medical books in the pictures too. And your teachers will also get you introduce this type of mechanical aids in the laboratory. And the fifth one is raise the patient's bed. Adjust or reposition the client's bed so that weight is at the level of the nurse's center of gravity. Always raise the bed. Now we are going to discuss about the next guidelines, that is frequent position changes. Note that any position, correct or incorrect, can be detrimental to the persons or a patients if maintained for a long period of time. That is, if you keep the client or the patient in just one position, it can be dangerous for them. Reposition them every 2 hours. That will help to prevent the complications such as pressure ulcers and the skin breakdown. And next guideline for the patient positioning is avoid friction and shading. When moving patients, lift rather than to slide to prevent the friction that can attract the skin, making it more prone to the skin breakdown. If there will be skin breakdown, you have to avoid the slide boards. Use the mechanical lift. I will also introduce you to the mechanical lift in few videos. It is the lift that is used to lift the patients, and there are some policies of the mechanical lift how to use them. So I will introduce each and every point in that video. So now we will move to the next points of the guidelines. And the last topic is maintain the proper body mechanics. Observe good body mechanics for you and your patient's safety. Position and self control to the client. Avoid twisting your back, neck, and pelvis by keeping them aligned. So, first, your safety is must. If you are safe, the patient will be safe. There are some body mechanics techniques how to do the transfer or how to reposition. You have to learn that, because if you don't learn that, it will take your back throughout the job. So save your back, learn the technique, and avoid these incidents, that is twisting of back, because then it will be so much difficult for you to keep the job. Next one is the flex your knees. Yes, this is the most important point. You have to flex your knees and keep the feet wide apart. Next points of the body mechanics are use your arms and legs but not your back. Yes, this is the most important point. Always use your arms and leg but not your back. Avoid using your back at its most, because it will hurt your back and you will not able to continue your job for a long time. And next point is tighten the abdominal muscles and the gluteal muscles in the preparation of the move. Next is person with the heaviest load coordinates efforts of the nurse and initiates the count to 3. Thank you everyone who has watched this video till the end. I hope you have liked this video. Please subscribe to my channel and like my videos. Thank you so much. And I am coming with new videos which will be related to the topics.